So I'm here with Dr. Larry Palevsky, and I'm going to ask him to introduce himself.
Hi, Val. Thank you for inviting me to have a conversation with you today. I am a New York State licensed pediatrician in the United States, and I've been a pediatrician since 1987. And over the 36 years since I graduated medical school, I've had an amazing experience in all parts of Western medicine, where I worked in an ER, I ran an ICU, I worked in a neonatal ICU, taught residents and medical students, did inpatient pediatric rounds, I worked in a clinic, I went to high-risk deliveries, and then slowly but surely, I started to expand my knowledge of Western medicine and realized that I wanted to learn more than what I was taught in Western medicine. And I became what some would say is a holistic integrative pediatric doctor. And so since the early 2000s, I have been in practice working with families, trying to approach their children's health in a different way than what I was trained to do. So it's not suppressive medication. It's not treatment at all costs. It's not make the symptoms go away, but it's actually try to help support the body through its symptoms, recognize that not everything that children are experiencing are based on infections, that actually they're resolutions of inflammatory processes that need us to get out of the way and support them and not get in the way and treat them. And I do a lot of work around the subject of parenting and child development and vaccinations and just seeking the truth and raising awareness and raising critical thinking in a way that allows parents to not just hear, they say, therefore it is, but to actually have other viewpoints to weigh in, because parents, I feel, are better parents when they're empowered than when the doctor says something and the parent just listens and doesn't take any responsibility or accountability. And I think we're in a very interesting time in the world with COVID and the tyrannical attempts that we're seeing in the world. And we can do a lot better by raising our kids differently so that something like tyranny is not going to happen so easily again.
Well, and that's why I invited you to have this conversation with me, because I heard a little bit about that when we met through an online meeting that somebody else had brokered, if you like. And I just saw that, you're steeped for decades within your profession and health and so on, straddling obviously outside of the parameters of it. And equally, I've had just as long a career, but focused on education and children. So I began as what you'd call a high school teacher, a secondary school teacher of English over here. And then I spent most of my career at a university training other teachers to be teachers. And then I also had a stint as Her Majesty's Government Ofsted Inspector for schools, which took me around the country, being involved in observing classrooms and teachers' practice. And then I've also been, and currently am, an education advisor for one of our local authorities, where I work with a lot of vulnerable children who can no longer attend school for a variety of reasons. Either their special needs are such that mainstream schools no longer accommodate them, or because their mental health has become skyrocketed so much that they're too anxious to attend school. So my job is to work with the parents, advise them on how to restore their child to some kind of equilibrium. So I do think it'll be interesting for us to explore, because I do think there are points of alignment. My chief focus, if you like, has been, how do we empower babies, not just children, to have a voice? How do we make them agentive in their world? How do we honor the fact that they arrive perfect in every way? And for us to know what they need just to reveal that very best version of themselves. They don't have to become anything other than what they are, and we need to remove the blocks to their progress, their process, actually, because I do feel that we can loan our emotional and more mature emotional framework for them, but not in a way that is imposition and not in a way that is our agenda. We
Right.
kind of, almost like a dance. We're asked, we step back, they step forward, and we adjust around. So yeah, that's what and I can see that whilst we've got very different contexts, we're probably working with a similar set of strategies,
Right,
and principles.
well, it's interesting. As you were asking me the question, I'm thinking of like 10 ways I can answer that question. So I'm going to try and pick one and see where we go. I think when adults become new parents, there's so much that is put onto the child, and there's so much that we want from that child and hoping that child becomes. And what the baby, because the baby is very helpless and very needy, and the parents promise that they're going to provide the kid with everything, anything that child will ever need. One of the things that I notice when I'm working with parents is the right off the bat inability to welcome the child's discomfort. And so as soon as a baby cries, because babies are helpless, so they're going to cry right away. As soon as a baby cries, the knee-jerk response from the adult is, it's okay, it's okay, it's okay. And I allow the parent in my office to do that. And then I take a step back when everything's quiet and I look at the adults and I say, I have to ask you a question. If you were upset about something and somebody came over to you and said, it's okay, how would you feel? And the parent would sort of just stop and like wide-eyed look at me. And of course, the answer would become, yeah, I probably wouldn't like it so much. And I said, so how do we welcome the child's discomfort and allow the child to feel comforted by you without just medicating it with, it's okay, it's okay, it's okay? Because what does the child really need, which is what we need all the time, is connection. Child needs acknowledgement. The child needs bonding, because the child doesn't know the child is a child until it's reflected through your voice and through your eyes and through your touch and through your smell. And so what the child needs in that moment is, I know, I understand, I hear you, I'm right here, I'll help you, I'll take care of you, I'm with you, I got you, tell me about it, I'll figure out what you need. And so
it's interesting, isn't it? Because I think the parent is saying it's okay because that's what they need, because they're scared, because they're anxious. So they're trying to reassure themselves that I don't need to panic. I don't need to panic. It's okay. It's okay. But actually, you're right. Like, you're imposing your discomfort upon the child. Let's just pretend everything's okay.
And that's the key, is in the conversation that I have with the parents, I'll bring up the fact that what I think you might be doing is trying to appease your discomfort because you don't know what to do in that moment.
Yeah.
And so your child needs to know that you don't know what to do in that moment, because your child will be much more comfortable knowing that you're figuring it out too. But at least you can bond, you connect, you can acknowledge, you can reach the heart and say, I get it. I mean, a lot of times in my office, Val, I'll see a kid who's angry or a kid who's having a tantrum, and the parent, will in some way, shape, or form say, stop crying, or
stop crying. It's worse than it's okay. Stop crying.
And of course, the kid just screams louder. And then I'll look at the kid and say, yeah, I know you're upset. Let it out. I want to hear it. And the child does the following. just looks up at me with this strange quiet, as if to say, how did you know? And feels okay to stop, because all I did was say, yeah, you're angry and I get it. You deserve to be angry, and that's okay. And let it out. And I'm right here to be with you while you have your emotion. And this is where we are speaking the same language. And that is that children are comfortable in certain situations and they're uncomfortable in situations. And neither of those entities lasts. And when we as adults try to take away 50% of life's experience, we never give children the opportunity to experience a beginning, a middle, and an end to the discomfort, only to realize that life goes on, they're fine, they're good, they have options, and they made it through the discomfort in your presence, in your connection, in your bonding, in your acknowledgement. So they feel safe enough to say, yeah, discomfort exists, but I can be okay and even better. And I learned a skill, Val, that if I'm uncomfortable, life won't fall apart. I won't fall apart.
And my parents don't turn to pillars of stone.
There you go.
So it's interesting. You reminded me of a situation. I have the privilege of going into people's homes and meeting families there. They don't come to me, I go to them. So I'm within the family setting. And I can remember this little boy, probably 5 or 6, and various learning needs, various diagnoses, but a sensible enough parent who, when he acts out like that and storms around, we observe. And as you say, don't really intervene. And then out of the blue, a few minutes later, he crawls onto the sofa, he puts his arms around me and he says, I want you to hug me. Yep. And Mum took a photograph of that. Marvelous. It was exactly and perfectly an illustration of what you're talking about. And I guess for me, I want parents to know that a child's voice, their language development begins at birth. And those screams and those cries for food and primal needs are part of them, letting you know that. So of course, feed them, you don't let them cry without that. And of course, in the early days, it's just feverish wanting to feed, it's just, they're banging their head on you, trying to get their nourishment. But after a while, and they're still babies, they're still young babies, the feeding becomes a little bit more, what's the word, sort of established. And they're starting to realize these are really tender moments with Mum. And they're actually, their breastfeeding pattern, or their feeding pattern, I don't suppose it has to be the breast, they will learn turn taking. They will learn to have a dialogue with Mum. So every mum knows that there becomes, after a little while, a time where they're sucking furiously and then they stop. And then you talk to them. You're normally there. Well, I hope this is what parents are still doing. There weren't mobile phones when I was bringing up my children. I hope they're not busy texting or checking emails while they're doing this. I hope they're getting eye contact with their baby, because their baby, as well as breastfeeding, is trying to talk to them. And then after the furious feeding, you talk to them and you make eye contact with them, and they stop feeding and they look and they pay attention. Then when you stop, they start feeding again. That's a really important part of them having a dialogue, of learning how to have a conversation. It's actually the very beginnings of language for them, of speech.
Sure. Well, it's interesting because babies learn language even in utero, because they
yes, of course. Yeah.
They have the receptive language.
Well, you would know more about that. Yeah.
Right. But what's interesting in that description that you just gave is that one of the things that I teach mothers, especially mothers who are nursing where there's a little bit of a problem with latch or a problem with, nipple tension or her pain, is that as soon as I am able to show the mother what breathing actually does to that bond between the baby and the mother, breastfeeding just takes off.
Yeah.
Because especially first-time mothers, the tension in the mother's body, the crunching of the body, the forcing, trying to get the nipple in the mouth, And when I work with the mom to sit back, relax, stop with all the maneuvers to put the nipple in the baby and just breathe. And what happens when the mother breathes is you lower the adrenaline dynamic, because the stress, I mean, both mother and baby have high levels of adrenaline automatically after birth. And the thing is that the baby can't lower that adrenaline, but the adult, the mother, can. And one of the ways to lower that adrenaline dynamic is to breathe. And what happens is the baby's at a North Pole and then the mother becomes the South Pole. And the two magnets can attract because the mother has reduced that North Pole dynamic and no longer is
Oh,
adrenaline.
how interesting.
The breathing increases the relaxation response. It lowers the adrenaline dynamic, but mostly what it does is it allows the baby to stop, sucking so hard because the tension relaxes. And the nipple starts to cone and go into the baby's mouth. And once the nipple hits the palate, it signals the brain to suck. Because if the mother's not breathing, then the nipple is not moving into the back of the mouth. Then the nipple stays in the front of the mouth and the baby falls asleep. And so, because the baby doesn't know that the nipple is there for the baby to suck. And every time that mother breathes, the baby gets the nipple, hits the palate, and the baby starts to suck.
I can see physiologically how that would happen, because you automatically breathe deeper and your chest expands, doesn't it? And you can see how that would happen.